I was just saying that it's very interesting to talk about what's happening here at the JR. But what I would like to talk about, I have my colleague here, Monica, as well. So my name's Joanne Brooke, and I work for Oxford University. What I'd like to talk about is some of the initiatives that have happened that actually support people with dementia whilst they're in hospital. So rather than identifying and looking at risk factors for dealing with dementia, it's actually some of the more practical elements that have been implemented. And my work mainly has come from the Royal Berkshire Hospital in Reading. And that's why I have Monica with me, who's from the JR. So we'll talk more about what's happening at the JR. So I would just like to talk about some initiatives to support people with dementia when they're inpatients, and just to look at the various initiatives that have happened, including aspects around the environments that the patients are being cared for in, the training of staff, third sector provisions within the acute setting, and also looking at specialist roles that have been developed to support people with dementia in the acute setting. So one of the things that we managed to do at Royal Berkshire Hospital is actually change the environment quite significantly in a couple of the wards. So we have 4 wards now at Royal Berkshire Hospital that have been deemed dementia friendly. Don't quite like the term myself, but I'll explain what's meant by that. So you can see from these 2 pictures, the picture of the wooden floor is now described as dementia friendly, where the other one is the original ward that you might see on any ward environment that you go to in an acute setting. So the things that have changed to support people living with dementia, the first thing that you can notice is the shiny floors. So the shiny floors have completely been removed and a wooden floor is put down. So it doesn't look like those pools of light that are reflecting on the floor. So they are, as you can see with people living with dementia, as water on the floor. So rather than having that aspect, so that's been removed and the wooden floors put down. But you can also see things. The lighting's one thing that's been changed in this, but also if you start to look at the clutter in the picture with the shiny floors has been removed, and some of the walls have been removed and low-level desks put in as well, just to open the space out a little bit so it doesn't look so cluttered and confusing for someone that may not been to an acute hospital environment before, and then coming in with living with dementia can be very confusing. So if I move on to something else that's happened on these 4 walls, which is really important, is the big nursing station. If you usually visited any ward, there's normally a huge nursing station with medical professionals as well as nurses sitting behind. And as you can see from this picture, or if you can't, there's a desk and notes on the desk. There's actually a person sitting behind there. So the receptionist on this ward happens to be sitting behind the desk. It's clearly not visible at all. So the nursing stations on 4 of the main wards at RBH have been removed completely, and the seating area put in instead. So actually to kind of remove, to have all the things that you need from an acute hospital ward, but to try and remove the look of the fact that it's an acute hospital environment. So there's a much more open area where patients and staff alike sit together and write notes or have a coffee. So again, RBH has been quite lucky. I'm not quite so sure if JR is quite so lucky that each ward has a day room still. So the day rooms weren't tend to be used for what they should be used. So they tend to be storage areas, which happens quite frequently across hospitals. So this was there's an active involvement of when the wards were being redesigned to remove all the clutter from these rooms and create rooms where it doesn't matter whether the patients have dementia or not, but to create rooms where patients could go when they were feeling a bit better, wanted to watch television, wanted to just remove themselves from the hospital environment. So each of the wards and their day rooms were created into different scenarios. So you can see in this picture in particular, there was a cinema room. So during the afternoon, some old films or sporting events, or whatever happened at the time in the news, tend to be put on television, and so groups of patients would then go and interact with each other and watch the news or sports events together, rather than sitting around their beds in the hospital environment. So this is another example. So one of the 4 wards had a cinema room, another was much more news-based, the newspapers, and we're in Reading, so all of the newspapers that you can see on the back of the wall were newspapers from Reading. So it's old stories that was happening in Reading for participants to engage in. One of the things that was introduced to each of the wards, which you can see from the optical lights on the side of this machine, was called sensory machine. So each of the wards had one which had different functions to engage people, such as music, such as the lights. But as it happens, they weren't that popular long. They weren't particularly used in these wards. So something else that happened that was quite interesting, because hospitals tend to have the same colour throughout. So you might be on a ward that has 4 different bays, all the same colour. They might be either numbered A, B or C, or 1, 2, 3, and you're often told, oh, you're in Bay C or Bay D, which gives you no identification when walking around the ward what bay is what. So one thing they did was actually colour the walls. So you had a blue bay, a yellow bay, a green bay. And so the blue bay, as you can see by this one, was called Seaside Bay. So the walls would be painted blue, and the pictures within the little bay itself would all be seaside pictures as well, just so that any patients could identify quite easily where their bed was. If they wandered off to a bathroom or toilet or meeting, they could come back and know that they were in the blue bay, rather than looking for numbers or letters on the wall. One of the things that has changed, I'm pleased to say, since this, in this picture in particular, is the murals on the windows. So if you can see at the back, there's kind of opaque cutouts of a boat on the windows. And actually we advised eventually that they should be taken down, because you're cutting out natural lights. And actually people in that bay couldn't see out the window. And actually to be able to see out the window and see life go by, actually out this window is a multi-storey car park, but you can still see life go by, rather than not actually gauging what the weather was like. So those have actually come down, which I think is quite good. The other thing, as you can see with the bed area, there was individual pictures over each bed. So if someone couldn't quite work out what bed they were in, we could change the pictures as well to make them relevant to the person. So hopefully again, that just gives some kind of clue to which bed was theirs. And the clock in this picture, because we had clocks visible and the date and the time visible in every environment. So that was the environment particularly, and this document about the training of staff came out in November 2015, ensuring that all staff, health and social care staff, and anyone that came into contact with patients, whether it be a cleaner or someone serving meals or someone as a ward clerk, had an element of training with dementia. So this came out in 2015, and all trusts across the UK have really been involved in upskilling staff. So within this document, there's 3 levels of training which we call tiers. So the tier 1 is dementia awareness. So everyone in the hospital, anyone who steps foot in the hospital has had the tier 1 dementia training. And then tier 2 is people that have more contact with patients, and tier 3 is lab experts. So this is something that has really been incorporated by every NHS staff. Within Royal Berkshire Hospital in particular, and I know some of this happened at the JR as well, simulation workshops happened. So we would have very creative people that had worked with people with dementia that actually took themselves and acted as someone with dementia to actually have our staff in a safe environment where they could make mistakes or errors with someone acting as though they had dementia. And some of these actresses, and I know this is a bit controversial, but the actresses I've worked with were very good at remaining in character and clearly had insight into supporting people with dementia. So the staff tended to learn a lot from this. And we know this because we did some evaluation to the staff. So the training that I was talking about, simulation training, was recommended by Health Education England, Thames Valley. So they called it GELS, so Dementia Education and Learning Through Simulation. So we used their forms to evaluate the outcome of staff. And when I say staff, it's predominantly nurses. And what we did a pre-questionnaire to test their knowledge of dementia, but this isn't what it was about, and a post-questionnaire for our qualified nurses. The questionnaire had up to 31 marks, and what you can see from this quite simple pie chart is the fact that even though this was simulation and interacting with people with dementia, their knowledge about dementia grew considerably, which I think is an important point. This was tier 2 level training. But what I'm more interested in is the fact that the staff came out having increased confidence in caring for people with dementia. Because some of these staff who might have trained 10 years ago, dementia wouldn't have actually been on their curriculum. So it's important to remember that fact. So this is really important, the fact that their knowledge had improved, but also their confidence had improved. So when I talk about third sector, lucky enough for us at Royal Berkshire, when I was there, the local museum of English rural life happened to be closed refurbishment. So we had some of their staff visiting our wards and would do reminiscing sessions with artefacts from the museum, which was always very interesting and very captivating for any patients that tended to get involved in that, and that happens on a weekly basis. But we also had other aspects, so you can see there a member of the clergy would come and do reminiscence. We also had, we didn't do singing for the brain, but we had our Deputy Director of Nursing was really interested in singing, and operatics in particular, who used to once a month come and do a session, and any patients would join that as well. So there's a lot of involvement from other people and other things going on, particularly in the hospital, to support not just the training and the environment, but you know, a holistic approach to supporting these patients. And so
so my name is Monica Rabatka, and I'm a research fellow with Jo at Oxford Brookes University. So what I want to talk about is actually one of the projects Jo and I brought in about 18 months ago now for a year pilot, and its role and what it was about was activity coordinators. So the 2009 document of supporting people to live well with dementia talks about how us as care providers, whether we're in care homes or hospitals, needed to provide something that provided a purpose while people were in our care. And what they looked at was activities, but not just any activities, looking at things that would match their interests and hopefully kind of maintain or improve their well-being. So what the JR did, funded by Health Education England, was put in a year pilot of 2 activity coordinators that were based on their acute general medicine units. So again, it's kind of level 7. And the reason we chose that specific area was because in prevalence-wise, they had more dementia patients than any of the other wards. We felt it was the best place to kind of look at that kind of cohort of people. And we chose for our activity coordinators to have non-healthcare backgrounds. So we didn't go for people who had any real experience in the NHS, but what they were bringing was specialisms in art and music. So the 2 activity coordinators we employed, one had a degree in illustration and did a lot of kind of clay and kind of craft skills, and the other person had a master's in music. So really came from those areas directly, which has been slightly different to what other people have done around having maybe someone who has an NHS background with an interest in a specific creative art. So we felt that would kind of benefit our patients a bit more. The expertise was in the activity rather than necessarily in dementia or NHS experience. We also thought that by having someone who was of those specialist backgrounds, we could teach them about NHS workings and about dementia, or that we could teach someone who had the dementia experience about arts and music. So this project is actually coming to an end at the end of this month, and we've had it in place for a year. And what we found so far from our initial findings was that actually there was increased engagement with patients with dementia during their acute hospital stay. And it turned that as part of the ODT working, so with our doctors, physios, etc., they were starting to promote activities as part of the patient's care plan. So it wasn't just looking at maybe this person needs to go on this medication for whatever reason they've been admitted into hospital, or they have dementia, so we need to look out for kind of their needs, like previous presentation stated. But it was also looking at actually a holistic approach, looking at what is that person interested in. Maybe they'd like to attend some of our music sessions, or whether they would want kind of one-to-one kind of arts or craft experience. We also had that anecdotal increase to patients' nutritional care. We found that because we were engaging with them more, that we were able to increase nutritionally, but also increase the involvement of family members of the person living with dementia, because we had to ask them really what kind of things would your kind of loved one have interest in while they were with us. So that project is coming to an end at the end of this month, and then we'll hopefully find out more data on the impact it's had with the turnout over the last year. Other initiatives are these, the Twiddle Bus. They were outside on kind of one of the stalls. It's one thing that as a hospital we're always in great need of. We use them in several different areas, not just general medicine, but also use them in our trauma theatre, things like that. And they're designed to kind of distract people who are living with dementia during their stay and kind of also reduce their anxiety and stress for a different environment. Means that also if someone is in one ward and then move through an X-ray and then move somewhere else, they can actually have something with them that is kind of familiar, so it's not whole new environments. So if there are any keen and added lifters, we do actually have lifting kind of instructions, which I find really confusing, but supposedly they're really simple. That if you could just Google OUH through the mask, it's one of the first things that come up. But yeah, thank you very much for listening to us.